My name is Magdalena. I develop drug combinations for the treatment of cancer. Yes, I do have a box full of candies with me. Imagine that each candy represents a drug, and altogether they represent all available drugs against all diseases. Yes, they have been developed and approved to treat one specific disease, but because of their characteristics, some of them might be good candidates for the treatment of cancer. This is the concept of repurposing, to use a known drug for another purpose, for another disease. Currently, drug repurposing is used to find a treatment against COVID-19. To these available drugs, there are several advantages. For example, their clinical characteristics are already described, and it saves time and money to use what is ready to use. This means already approved to a clinical indication. To reduce and select further from all these available drugs, I also look at the mechanism of action, the safety profile, and if they can be applied in a multi-drug mixture. In other words, I look at the taste, the size, and the kilocalories of the candies. When this first selection has been made, I apply a technique that has been developed and patented by our laboratory. In 3 search rounds, less than 280 combinations are tested experimentally in the laboratory, simply looking at how the cancer cells respond to the treatment. Afterwards, these results are fed into a mathematical model calculating the effect of all possible combinations. Through this technique, I can also have a look at the drug qualities, for example, the dose-related effects or the presence of drug-drug interactions. Drugs will not be selected randomly, but in a directed fashion in regard of the complex biology of the cancer cells. With this technique, I found and tested such a drug combination in preclinical settings. It is composed of 4 repurposed drugs from different drug classes, each having a distinct mechanism of action. And now I am following the next steps to bring this drug combination closer to the clinical settings. Combining drugs and repurposing drugs saves time and money. It offers an innovative treatment option without following the general pipeline of drug development and approval of novel compounds. Through our unique approach, we can repurpose and combine drugs for any cancer type, still taking into account that each cancer and each patient is different. In other words, I aim to fight cancer, finding the best combination of candies.